o'clock, WNST, South Baltimore and Baltimore Positive. We are positively at Mako. It's a Maryland Counties Conference. We're in Ocean City, Maryland. I am not out on the beach. I'm not like flying a kite. I'm not racing go-karts. I'm not even eating Thrasher's French fries. We're here at the Convention Center, being joined by some cool guests and returning champions, as we say. Ed Lovern rhymes with govern. He's over at Ascension St. Agnes, running a hospital that I think everybody's familiar with. We drive by, but last time I had you out, I think it was Christmas time in Catonsville. Crab cakes were involved, right?
It was a thrill. I think we met downtown Catonsville and talked about crab cakes, and I don't think I got any crab cakes that day. But
that's what he wants back on the show.
And I follow your crab cake contest and trials and
hijinks is what we call them.
You've done like what, 31 crab cakes?
Well,
in 31
don't forget
days?
the breweries now.
And the breweries
yeah,
too,
absolutely.
right?
We're doing breweries every day. I've done more breweries than crab cakes this year.
Okay.
I did more crab cakes than anything last year. It's the thing about this tour that I never really understood was how beautiful the state is.
Yeah.
That it's not the destination, although the crab cakes are great.
Yeah.
You know, seeing different restaurants, but seeing the rolling hills,
yeah.
Getting off 50, getting off of 68, going out, getting down the Deep Creek, just getting off the beaten path and seeing a beautiful state.
What fun. You got a great job.
Well, I used to talk about baseball and football.
Yeah.
But I still talk about those things.
Yeah.
Give me a little, like you come down here, you're a part of this conference. What do hospitals need here?
Thanks for asking. So I come down. I'm the CEO of Ascension St. Agnes, as you said, and obviously it's nice to represent my hospital. I'm really down here because I've had the opportunity to chair the Maryland Hospital Association's task force on the future workforce for healthcare. And we released a report about 2 weeks ago that we feel very positive about, that has laid out a pathway to improve our situation with the healthcare workforce. Currently, hospitals and other healthcare providers are struggling because the healthcare workforce is dwindling. And we have, statewide, we're probably short about 5,000 nurses, about 4,000 LPNs. And we did a big analysis as part of this task force and found that that's just going to get worse in the coming years. And the next dozen years, it could be get 3 times as bad.
So get your daughters and sons into nursing and doctor programs, right? Literally.
Yes, but there's a lot to that. And so what we were able to put together is a comprehensive plan for how to make that happen. And this was a great opportunity to come down and talk to our lawmakers about how we start to do that and the importance of doing it. And the beautiful thing is everybody is extremely responsive. So as I've talked to people about this, they're already aware that this is a crucial issue. They're asking what they can do. And fortunately, the hospitals have come together very collaboratively over the last year, put some money into doing the research, and now have a very specific plan on what we can do to make some changes to improve this in the years to come. It's been fun to put the report together, but now the real work begins of trying to implement it.
I've been fortunate enough a couple years ago with Damien, and you were over doing the Center Maryland podcast as well. The Maryland Hospital Association came together in Annapolis almost 3 years ago now, right before the plague, right? My wife and I had been in Japan and South Korea, in Asia. We came back. It was right around the time she got sick in middle of January. It was during the lobbying periods, and it was cold morning. And I went down and I sat with John Shisher and Neil Meltzer, just all of your colleagues, on a couch talking about the issue of suburban hospitals, staffing. And then the plague hits, right? And then everything 4 months later is government, hospitals, keeping workers safe, keeping if you cut your hand in your kitchen during the plague, how do you get to the hospital? Who can go with you? How can you get – like all of those external issues. How have things changed in the 3 years? Because I would say your lobby probably is a lot stronger in the aftermath, sadly, of COVID, because I think we all understand overcrowding at hospitals, not enough workers at hospitals, big problem. My wife spent 155 nights fighting for her life, so we're very, very aware of the importance of clean, safe hospitals with dedicated workforce, not overworked people, but more people there than we need.
You describe it well, and first of all, we are grateful for the support that hospitals got during the pandemic. That I think people recognize the contribution we made, lawmakers helped from a funding standpoint, and we did what we needed to do to take care of people during that time. it was disruptive, and it was, I think, a challenge from a staffing standpoint because the staff, as you can imagine, were at the forefront of all the things that we were doing. And they were the ones who were on the risk side of this. And we lost a lot of staff during that time period. People decided they didn't want to be in healthcare anymore. They left the field. They did other things. And so we always have different cycles where we have shortages of healthcare staff. But this is more of a perfect storm where we're seeing not just a regular cycle, but we're also seeing people leave the workforce and people struggling to get back into it.
I'm hearing this from teachers too.
Yeah,
right.
right.
I mean, the pandemic has had a lot of unintended consequences,
Yep.
and part of it is career change for people that just said, "I'm going to do something different with my life."
Exactly.
Right?
Yeah.
And when we have doctors and nurses do that, that's a real. We have teachers do that's a problem too.
Right.
We have airline pilots doing all of these jobs, but
Right.
specifically we're talking about life-saving jobs, and we're talking about things that. Skilled labor, what these people that kept my wife alive, when these nurses came every night, specialized nurses, I thought to myself, I don't think I could ever go to school to learn enough to do it. It's not an easy job. Anything in your hospital is not easy.
No, Nestor, you describe it well because it's not a job that can be done remotely. It's
No.
a job you have to be there. You have to be there 24/7. It's hard work. When the nurses I know, it's rewarding work. It has a lot of opportunity. And our pitch is we need to do some things to change the environment of how we change our nurse or how we train our nurses and healthcare workers. We know that a change has happened, that people don't come into the hospital and work there for 30 years. People come in, they may work as a nurse for 5 years and then decide to do something different. And we need to be very supportive and facilitate that so that, they come in and they, when they have opportunities to do something different, move up to be nurse practitioners or be salespeople for medical device companies, that we're supportive of that and helping make it happen, but also figuring out who's going to come in to replace them. So we've got to really rethink this, how to make it easier for people to get into the field, how to have people. When you talked in the beginning about having your sons and daughters become nurses, it's thinking about how males can get into nursing, how different populations who maybe haven't thought about it as an opportunity get into that. So how do we expand the pipeline? How do we avoid the current 20% dropout rate in nursing, which happens in nursing school, which happens because sometimes there's not the wraparound services to help people go through school. So there's not the daycare. There's not some people just can't take time off to go through school. They have to have that support. So how do we rethink that? And then how do we retain our staff? One of the big challenges, it's always been there, but it's gotten worse during the pandemic, is the violence and harassment of healthcare workers. And we have to have a statewide consortium to really rethink this. There's a federal bill.
It's amazing you have to talk about that.
Well,
right? But I know
yeah.
from where we've been the last 3 years how crazy that is. And I have friends that are nurses, obviously, too.
Yeah.
That this is a real challenge, right?
It's
talking
huge.
to families, when my wife was sick, there's me, her dad, her mother. We all reacted differently.
Right.
And the nurse and the docs are the front line of that. There's, sadly, I always thought there should have been some sort of administrator between, and I'm speaking about Hopkins,
Yeah.
and I even, believe me, I spoke to the top of Johns Hopkins when she was sick.
Mm-hmm.
I said there should be somebody between us so that I'm not being emotional with my dying wife in front of a nurse, or there should be somebody in between. And it was a very difficult, for every family it's difficult.
It's the most difficult time of people's lives. And people are going through behavioral changes that are difficult to control, and so sometimes that results in things that they wouldn't do otherwise. But the recipients of that are often people who are my daughter or son's age, who are 24, 25, first job in nursing, and they're at the end of somebody who's not happy and showing it. So we have to think about how we change that. That's a big part of retention. And then I think the last thing is just we have to rethink how we do healthcare in some cases. So we have to take advantage of technology like telemedicine. We have to make sure that licensure laws allow people to move back and forth across state lines easily. We need to figure out how we don't have obstacles in the way of getting people from the military into hospitals with, rethinking the job. So you can take somebody who's been a healthcare provider in the military that may be slightly different in terms of their approach, but how do you move them quickly into a non-military job? So those are the things that we're working on. We're excited about it. I feel very strongly that Maryland like it does in so many other healthcare issues, it can lead the nation in how well we address this crisis by training people, getting people into healthcare, having a very robust workforce in our state, but also exporting staff outside the state. I mean, so our colleges and universities become the place where people are trained, like where people are trained at Hopkins and University of Maryland as doctors to go outside the state. We want to see more of that, where we're providing staff for other places. We have so many people here for our hospitals and for our nursing homes and for every other job that we're that good that other states look to us to get their staff. So we think we see this as a huge win-win, because this is going to grow our nursing programs at our colleges and universities, present great opportunities for people to move up in different career opportunities, and also create a very stable workforce for our hospitals and other healthcare facilities.
Ed Lovern's here. He is from Ascension St. Agnes in Baltimore City. Nothing more positive than Baltimore positive. Tell me about your company. And you've come in, and we talked about this a little bit last year in Catonsville as a visitor on our Maryland Crab Cake Tour. By the way, John Martin's coming up next. I need to say, brought to you by the Maryland Lottery, our friends at Goodwill, Window Nation, and the Restaurant Association of Maryland. We're going to be, next week, we're in Eldersburg on Wednesday at Liberatories. Friday, we are in Westminster at Roxall Grill. And then great. I just saw our next governor, Wes Moore, around the corner. He will be joining us on the 30th at Costas and Dundalk as well. For you with your group and Ascension, I mean, I see MedStar ads and I see big groups and stuff like that. Tell me about Ascension. This is sort of a newish thing, at least for Baltimore. Everybody knows St. Agnes, right? I can't say St. Agnes.
I hope everybody
anymore,
knows St.
right?
Agnes. Yeah, we call it Ascension St. Agnes because we are part of a national system that has a lot of resources. It's a 150 hospital system nationwide. So we are, the irony is, even though we're a small hospital in Baltimore, our system is bigger than any of the other Maryland systems.
You told me that last year, yeah.
So it's big. We get a lot of support and resources, in terms of how we practice clinically, because we have so many other hospitals around the country. But we think that we offer something different at Ascension St. Agnes than other hospitals in the state. We are a community hospital. We're very proud of that. We have an excellent medical staff. I think in the last Best Docs magazine, we had 90 of our medical staff members who were considered best docs in Baltimore. So they are there because they want to practice community medicine, and they want to be they want to live in the community, they want to live close to the people that they take care of. And I think we have to pride ourselves on going the extra mile and taking care of the things and feeling closer to people than maybe sometimes the big university hospitals are able to do. So that's what we pride ourselves on. That's what we go to work every day, trying to make sure that we're providing great care for our community, making sure it's accessible. We're very efficient compared to some of the bigger hospitals. We're very proud of it. We think we have an important role to play in this community.
Well, look, I'm out having crab cakes for the next 31 days and beer at breweries. You don't want any part of that. But we will get together on the other side. I want to come over and visit and say hello one day. The interesting part of your hospital is really near where Babe Ruth played his childhood ball. So every time I go by there, I always think about my tour with Mike Gibbons and the folks at the Babe Ruth Museum over there at the St. Mary's Seminary, right around the corner. But Gibbons, all those things are right in the neighborhood there. Kibbe's was right around the corner with the shrimp salad for years too.
There is so much history in Baltimore, right? Anytime you turn the corner, there's something that happened that changed the country. And
what's your favorite part of Baltimore, being imported the way you are?
So my wife grew up in Baltimore, so we've got that connection.
So you knew about snowballs, crab cakes, you knew all this.
Absolutely, and we love living in Canton. So we live in Canton. I think we're the oldest people that live in Canton.
No.
But we love living there, and we have a blast being able to walk to wherever we go to the restaurants. And and to look outside and see the harbor and see all that's going on there, it's an exciting place to live. So we love it.
When you're walking distance from Nacho Mama's and, you get the right kind of chips and salsa and Berea quesadillas, as my wife would say.
Yeah.
We only have those in Towson, right? They don't have those in Canton. Ed Lovern's our guest, Ascension St. Agnes. I wouldn't say stop by and see him, but you do need, I'm 50-something. My wife's been on me a little bit about time for checkup, so it's never a bad time to say stop by and see. Stop by and see and get everybody needs a doctor. So
Dr. Bill Cook will reach out this afternoon to set up an appointment.
Give him the speech that I need to see somebody special.
Absolutely. And I think that you were getting at it before, but that's sort of that homespun type of approach that we take at St. Agnes. So I mentioned Dr. Bill Cook, who is head of our employed physicians, but also practices half-time. Literally every time I walk down the street in Catonsville or end up getting to meet somebody, that's the first thing they say. Oh, my doctor is Dr. Bill Cook. Now, obviously,
he can't take care of all of you.
You wouldn't think so, but for some reason, and when we walked in the 4th of July parade with Dr. Cook, everybody's yelling at him. He grew up there. He loves the community, and so we have a lot of doctors that are like, there are more Bill Cooks at Ascension St. Agnes than just Bill, but there are people who are in that community. They grew up there. They want to practice medicine there. And absolutely, you need to get in and have your physical once a year now. You're a big boy.
See, ever since my mom left me, I don't have anybody other than my wife beating me up about this.
Well, we all get it.
All right. I'll go in. I'm sure I'm fine, though. I feel really healthy. We're down here at Mako, taking on great guests. John Martin from the Maryland Lottery going to be joining us. Heather Mazier will be here. Also, Ben Cardin, Senator Ben Cardin, stopping by down here in Ocean City. Really appreciate you visiting, man. I'm shaking hands again. My wife's got things out, and you're a medical guy. I'm trying to stay clean.
I know. I can't keep
here.
It's
there we
go.
Go. Fist bumping. There we go. We're down here in Ocean City. We're doing things all brought to you by the Maryland Lottery in conjunction with our friends at Window Nation and at Goodwill and, of course, the Restaurant Association of Maryland. Don't touch me again. We're getting squirted with all sorts of good stuff here. Back for more from the Ocean City Convention Center. We are Purelled up and disinfectant free. We're BaltimorePositive.com. Stay with us.